I think most of us suffer some sort of back pain from time to time, but too often we treat the pain and not the cause. Now there is a new Australian invention called a spinal analysis machine, or SAM for short, which can pinpoint the cause of the pain. To tell us more, please welcome chiropractor Dr. Michael Epstein. Welcome, Doctor. Okay, well, let's talk about the machine. You, in fact, have it with you there. How does this machine work?
The machine is it's made of hydraulics underneath there to make the pumps move up and down for the scales. It checks the symmetry of the body. It checks to see if the hips are level, the shoulders are level, gets an idea if you're standing straight, because the machine is symmetrical. So if you're not, it will be very obvious on the machine. If you are then shown to be uneven, because of the hydraulics in the base of the machine, we can actually raise you up on that side that you're lower on to see if it makes you look more even.
Okay, could we, is it easier to try it, demonstrate it?
It's quite easy.
Okay, well, why don't I stand on it then, and do I have to take my shoes off? Is it different with high heels? That's what High heels are very bad for us, aren't they? I know that, I've been through that before. So you stand on this machine.
Yes,
it's got scales on.
I know, everything's divided in
I don't think so.
Everything's divided in half.
Don't you dare come near those scales. Okay. So, so you stand on this.
Yeah, bring your feet right on the feet.
Don't you dare come near those scales. No, I'm going to cover them up. I'm covering them up, see? See, oops.
But everything's divided in half.
Yeah. Okay, so...
now that you're standing on here, first thing I do, I'll stand behind you and just relax your arms.
Yep.
We'll bring the wires even so it's easy to see. And we check first the shoulders, and your right shoulder is lower. We check to see if the hips are level. And your right hip is definitely lower. In regards to, let's see, comparing the weight, which I won't say the number, you are carrying more weight on the right side. I'm
fatter on the right side.
Now, what we're going to do now is you're going to feel the floor move a little bit. You're going to feel the right side move.
The earth is going to move for me, I know.
I'm going to make the earth move. Now, let's see how it looks.
Get out of there.
Now, here we go.
Yeah. Oh, that's tilted, yeah. Okay, so this all does come back, Doctor, to chiropractic work. Once you've figured out, you know, where people are a little out of alignment, so you don't need an X-ray. Is this what you're telling me? Why wouldn't an X-ray be more efficient than this machine?
Well, I wouldn't say it replaces an X-ray. However, I use this as a diagnostic tool in the office so I can determine what part of the spine should be X-rayed. If you're looking straight and level up here and you're not presenting with any obvious symptoms or have a history where I might want to X-ray the neck anyway, and just your low back looks uneven, I'll take an X-ray of the low back because it gives me at least an objective measurement.
Okay, now you've tilted this way because I can definitely feel, you say I was a bit off on this right side,
well,
so you've tilted it that way.
I can tell you right now. I had to raise you 9 millimeters to make you look level.
So what does that actually mean?
That means either the leg is shorter by 9 millimeters, or the pelvis is out of alignment by 9 millimeters, or it's a combination of both, a shorter leg on the right and the hip out of alignment.
How would you then what do I do?
What do I do?
Well, come and sit down. Is it because I've been wearing too many high heels?
No. No, maybe one leg is shorter. Okay. But what I would say...
But why would one leg be shorter? I know it is actually a common problem.
It's a very common problem, and that's why, just in regards to back pain, because we stand on two legs, and very often slight imbalances, whilst unto themselves may not make it very obvious, over a long period of time, that's where the problems occur. It's like a car tire being out of alignment. We can drive all the way over town, not a problem. But if we leave it like that, the tires wear out. With the spine, if you're slightly out of alignment, it will cause arthritis, degeneration, back pain, sciatica, hip pain, even pain and symptoms further up in the body.
That's if you don't put your spine back into alignment. So this leads us to chiropractic work.
Yes.
Now, I am, in fact, a little familiar with chiropractic work, and I have no problem with it, but the number of doctors, GPs that I've spoken to say chiropractors, quacks. What's your response to that?
In regards to doctors themselves, most of them have never been exposed to chiropractic. They might have been told whilst they were learning to be a doctor that chiropractors were not reliable to go to. Chiropractors are highly trained. They're licensed by the government. They are recognized by all federal and state governments. All private health insurance covers chiropractic without a referral. You can see a chiropractor without seeing a doctor. But most reasons why most doctors don't feel recommended to send you to a chiropractor, it's because they don't feel comfortable with chiropractic. If in your own training you're never exposed to it and then you go into practice, you don't have that feeling of recommending a patient to it unless you actually are taking care of a doctor. I take care of Dr. Wright, so a lot of doctors do.
Dr. Wright.
Yeah, Dr. James Wright.
Okay, can you give us some examples of what chiropractic can do for someone? It's not a miracle cure, but what can chiropractic solve?
Chiropractors can fix migraines, neck pain, back pain, leg, shoulder pain, basically joint pain. The reason why, it's not so much chiropractic, but it's actual therapy we apply, which is known as spinal adjustments.
Well, run us through what a spinal adjustment is.
Spinal adjustment is a specialized type of manipulation which will improve mobility in the spine and the body, reduce symptoms associated with the spine, spinal pain, headaches, things of that nature, but more than that, it will actually make the spine straighter. I can show you on some x-rays an example.
Okay, we've just got to 30 seconds, so you can do that. Turn those on. So if something is out of alignment and, you know, somebody has got, oh, my back hurts, what can you show us from here?
On an x-ray, this is the lower back. This is the left hip, right leg, left leg, and the spine. The red dots show you where the spine is, and the black line shows you where the spine should be.
That's where the spine is there.
And the black line shows you where the spine should be. So you can imagine gravity pushing down on the spine constantly will cause damage to the discs and the joints.
Eventually. How many years would that take?
It depends. I have children I take care of. So symptoms, but on average, the average patient, usually 20 to 30s, they start feeling symptoms or signals in their body that there's something wrong. With corrective care, this is what we can obtain.
And what this is after what?
2 months.
After 2 months?
2 months.
So you can actually see, yeah.
Make a difference and objectively measure it, not just say you're better. We can actually show them.
So if something, you know, if something is obviously out and you leave that for too long over a period of months or years, it does in fact make sense that if you don't realign it, it is going to cause you long-term stress and problem.
Absolutely. It's such a straightforward approach. It's always still surprises me. Something so basic in its explanation is, to a lot of people, have never even been given the choice to even see a chiropractor or recommended. The AMA does recommend, well, it says it's completely fine for doctors to refer to patients, to chiropractors.
To get the right advice, do you need a machine, a device like that?
No, I can do it standing, just looking at a patient, but obviously to make it more objective and to make it more real for the patient, obviously a machine like this gives them more confidence to go to the next step, like to take an x-ray.
Terrific. Well, thank you very much for explaining that today, because there's so much talked about chiropractic these days, and it's interesting to see how it works on that machine. Ladies and gentlemen, Dr. Michael Epstein.